In this video, we are going to cover med administration via the MAR. I would first start by highlighting my patient. So in this case, it is Daisy Duck, and I can see under my med column right here that I have meds ordered on my patient. I could click on the meds, and this would open up a little description of my next scheduled med. I can see the medication, the route, the dose, just quick facts about your medication. Remember, in this system we cannot do screenshots, so it is important that you look up your meds and to know that there will be a computer in each med room so that we could pull up our EMAR and look at the meds we're going to give to make sure we're pulling the correct meds. Another thing to remember is you do not want to open up your meds before giving them because you will need your barcode to scan. You would also want to remember that if you want to go to the MAR from here, you can simply click Go to MAR. That will take you to the MAR. Or I could also scan my patient's band. If you scan your patient's band while you are on the tracker view, it will automatically open up your patient's MAR. It now takes you to this screen because I scanned my bracelet, and it says enter PIN. If you have not yet set up a PIN, the first time you enter the MAR, it will ask you to enter your network password, which is the password you put in to get into the system, and then it will make you create a 4-digit PIN and enter it twice. This PIN does not have to be changed. It is your authentication to access the MAR. It will be used to co-sign meds, to co-sign blood in the TAR, and this is just that instead of using your password when you're verifying things, it makes it quicker to just use a PIN that's identified to you. So you would enter your PIN, you'd hit enter. It will now let you see the MAR. Same thing as putting in the password now. The PIN is just an easier way to avoid having to enter longer passwords. On here, because I scanned my patient, I can now see that the patient's verified. If this had been a code and we're now back scanning our meds, because we obviously aren't going to sit there and scan in real time, we're going to give the meds, you have the option to hit manual barcode down here. And what this is asking is for that visit number, that account number, and it tells you right here. So you would do V31849. You don't have to enter in all those zeros, and you'd hit OK. I'm going to cancel right now because I already verified my account, and you would get the patient verified. However, it does tell us that you didn't scan, you manually barcoded. So it should only be used in emergent situations like a code, a patient that's seizing and needs Ativan, moderate sedation, etc. Now when I'm here, we're going to see that our meds are unverified, which is going to be the case in the ED frequently because we give our meds a lot quicker than sometimes they're checked in the pharmacy. So the most important thing is you don't break any of your barcodes on the meds because you're going to need to scan them. Same thing with your IV fluids. They're clear, so you want to make sure you put it up against something darker so that you can scan that little white label. Things that are mixed by the pharmacy should come up with a label for you, and you would just give them the same way you'd scan your meds. It's going to tell you medications unverified, continue with administration. That's okay. We're going to hit yes because we scanned our Tylenol. That's why it's highlighted. And now it's going to hit acknowledge and document like we normally would. And now this is just telling us that we're under by 325, which is okay because it's asking for 650. So you want to scan it twice. We would scan 2 pills. And now it's saying the ordered dose is 650 and the scanned dose is 650. There's no discrepancy. So it's going to take you to your pain assessment. You'd enter the reason you're giving the Tylenol for, your pain. If it was a fever, you'd put in your temperature, and you would just hit OK. Now on your MAR, you can see that you have a little barcode because you barcoded your medication. If you were signing off without scanning, let's say back in that emergent situation, you would just right-hand click the medication, and you would hit document. The document would tell you the medication's unverified. We're going to say yes, that's okay, we know, acknowledge and document. Right now we're going to hit yes because we're documenting against an old med. That's okay. And this would just take you through all the steps of how to document IV fluids. You're going to click an IV site, and because we don't have an IV site here, it's going to tell us there's no IV site, document your intervention. We can click it and hit document. This will take us to our IV assessment automatically. We're going to hit add an IV line, and I'm going to check where I put my IV line. And I'm going to hit OK, and then it'll prompt me to do all my documentation. This section is actually covered in a different video as well, so that's why I'm just answering these questions so that we can get back to our old screen. You hit save and exit. It now takes you right back to your MAR. On here, if I had charted it before I went into my MAR, I would have been able to just click my left forearm. Was the tubing changed? You can leave that blank. That's really just for inpatients. They have to chart this, so if we had a hold, we'd be able to say yes or no because we want to make sure it was changed. And you have to do nothing else. Everything else auto fills in for you. So you see here that the container volume is 1,000, the infusion rate's at 500, and you would just hit OK. And now here, we don't see a little scan because we didn't scan our medication. We're going to leave the heparin for now. We're going to say we didn't give it. You hit OK. This is a summary of everything you had administered. It's like another stop to check everything you did. You hit save. And now this is going to tell you that you have a pain reassessment. You can see here, assess pain. It cuts off the end because it can only fit 3 digits at 1618. And that will go onto your tracker under the med column now. It'll tell you when your reassessment is due. I can also see here from my fluids that it's supposed to end at 1720 because it's going in at 500 mLs an hour. I have a little tank that says it's full, and as it starts to go down, the tank will go down too. Once it reaches the infusion time, it automatically ends. So at 1720, this would go from being infusing like it is here where it says the INF to infused, and it would add to your INO panel. Same with if you had fluids going at 75 mLs an hour. You also have little information here. It doesn't matter which little icon you click or little character, they all take you to the same screen. It's just a different tab. So for example, if I click the M on the Tylenol, this is going to take me to a monogram detail section, which is really nice. It's going to give you in layman terms what information there is on the drug. It doesn't tell you dosing, but it does tell you side effects. It tells you uses, warnings, different brand names. This is really nice for the patients. You can actually hit print, and it'll allow you to print this for the patient. And then all of the other little pictures, like I was telling you before, are little icons up here. So that's why I say it doesn't matter which one you click, because you could just hit this and you'll be able to see the different tabs without clicking the pictures and going back and forth. Associated data, for example, is low lit because there's no associated data, but meds, for example, like heparin that are linked to a PTT, you would actually see the results in the associated data if there were results back for you to see. It's to kind of help you decrease going in and out of screens, which is a very nice feature. So on here, I'm going to hit cancel. I can still see I have a med outstanding to be given. It goes to the top. And now let's say that my patient tanked, or I needed to, for example, let's pretend this fluids was heparin. I needed to stop it because their PTT came back and it was too high. If I hit infuse and titrate, this allows me, and it's going to say medications unverified. We're going to hit yes. This allows me to change my infusion rate. So I would click the site again, left forearm, and on here I can put container volume 0. What this does is this says that I infused everything. So see how here it changes it to infused. If I hit OK, this will save as I gave a bolus, and I can put in a note saying, patient's blood pressure dropped per, Dr. Bell, infuse full fluid bolus. If it were heparin, and let's say we can say the container volume, let's say it still had 500. If I wanted to just put it on hold, if I hit 0 in the infusion, it puts it as a paused. So when I hit OK, it's now going to pause my infusion. So this is a really nice feature to use with your heparin if you have to pause it for an hour to draw your blood and then restart again, etc. And it also allows you to change rates. I could have just entered instead of 0, and what I mean is if I click infuse titrate here, I would be able to then again go back. So like on here I can put 120 now. It will restart my drip at that rate. And etc. You can just keep going, and this would make more sense, if it was a heparin. Otherwise, here it kind of confuses the system. But it lets you to decrease. Same thing if it was like a Levophed and you have an order, you can increase your titration. What are you increasing the infusion rate to? It tracks everything for you. So now, when I go to my main screen and I hit OK, I'm going to save my change. I go to my INO panel here. I would be able to see that I put my bolus on hold. So let's pretend this was heparin. Remember, like we did, we put it on hold because we had to redraw our labs and hold it for an hour. It tells you that I infused 33.3 mLs because that's what had infused prior to me hitting hold. So it's just really nice. It tracks everything for you. Lastly, if I hit tracker here, I could see on my main board that I still have heparin overdue, and I have a reassessment for pain at 16:18. So it updates with the most current screens. So it's going to be just very important that remember to scan everything, especially to not open packages before we give them. Our waste, you're going to want to waste like you normally would. Have your witness. Just remember to hold on to the vial because you're going to have to scan that when you go into the EMAR. So overall, it's very similar to the process we have now. It's just a little bit of a different change in process in the fact that we have to scan before we give meds.